guys, and welcome to the Expert Strategies for Working with Anxiety. This is Module 6. This is how to work with the root pain of highly anxious clients. This is by Michael Yapko, Ron Siegel, and Ruth Buczynski. Let's get into it. Dr. B. How do we help clients who don't even know what they can do to deal with their anxiety? According to Dr. Michael Yapko, we start by assessing how successful a client is at putting a few key skills to use. Here, Michael starts us with the first question to ask and what that can uncover. Dr. Yapko, from an epidemiological perspective, epidemiological perspective, anxiety is the most common issue that people present. You're in clinical practice for about 8 seconds before you see your first anxious client. So how you think about anxiety obviously is going to determine how you go about treating it. And as I mentioned previously, I am far more interested in the question of how someone generates anxiety rather than why. How do they perpetrate it? How do they get there? Anxiety is a broad label for a lot of different experiences, and there are many different pathways into anxiety, and which pathway a particular individual takes is critically important. So for some people, we know that rumination drives anxious symptoms, that when a person is spinning their thoughts around and around and around in a worrisome way, anxiety symptoms go up. And if there is some cure for rumination, it's action, and that becomes the focal point of treatment then. How do we convert the rumination into some form of action that is timely and helpful? For other people, their anxiety is about imagining dangers that they're not going to be able to cope with. Dr. B. So for Michael, it's the how of anxiety, not the why, that offers insight. Whether it's rumination or imagining dangers, if we could figure out how a client generates anxiety, we can use that information to help them slow it down. Now, back in Module 3, Dr. Christine Podesky described an equation for anxiety that factored in a person's estimation of danger as well as their level of resource. Let's go to Michael for his take on this formula. Dr. Yapko. There is, in essence, a formula for anxiety. One of the common denominators of anxious people is they invariably overestimate the risk and underestimate their own resources. So that suggests therapeutically how important it is to help people develop a means of risk assessment as well as being able to take a better inventory of what their own resources and capabilities are. When people don't have that awareness of themselves and what their own resources are, they just get lost in the feelings and get very anxious about things. There's another skill set that goes into it. If you can't distinguish imaginary threats from real ones, then every imaginary threat that flies through your mind becomes a real one to you when you react to it. So that ability to make that distinction is a very important cognitive skill. And I like what David Barlow said. David Barlow is a psychologist at Boston University who is probably one of the world's premier anxiety experts. After all these years of research that he's done, David simply said, anxiety is the price tag for planning. I love that phrase. Anxiety is the price tag for planning. As soon as you ask the question, what if? What if there's a 7.2 earthquake? What if I lose my job? What if my spouse cheats on me? What if? Asking what if raises anxiety in some way. None of those things are pleasant. What if I'm injured in an accident? What if I can't work? What if I'm broke? What if I lose my job? None of those things are what we want to think about. But as David pointed out, and I think he's absolutely right about that, the fact that people ask the what if question isn't the problem. And the fact that they consider terrible possibilities isn't the problem. I think the problem is when they ask what if, they don't answer the question. I think the most critical thing, answering the question, how do we move this thing that seems impossible to deal with and obviously unpleasant? How do we take it from unpleasant and unmanageable to unpleasant but manageable. How do we break it down into something that, okay, you don't want to have to deal with it, but if worse comes to worse, then you can. If worse comes to worse, you can. That you're aware enough of yourself to know what your resources are that you can bring to bear on this situation, so that, as unpleasant as it would be, that you'd still be able to handle it. Well, the what if question speaks to one of the things that we have learned about people who are prone to anxiety. They too typically have the global cognitive style, responding to everything all at once without really distinguishing this part of it from that part of it. But one of the things that we've learned is the people who are prone to anxiety disorders do not respond to ambiguity, ambiguity, in the same way as people who are not prone to anxiety disorders. Dr. B. Now, that's an important point. It's not that ambiguity leads to anxiety. Some people are perfectly capable of facing uncertainty and approaching it with little to no anxiety, but for others, uncertainty is a recipe for anxiety. Now, why is that? Dr. Yapko. This is a very robust research finding that comes out of the realm of cognitive neuroscience, that when people face uncertainty, which all of us do, uncertainty invites projection. And what if you project into uncertainty is danger and imminent harm? Then your anxiety level is going to shoot up correspondingly. So it becomes one of the therapeutic goals. Then, how do you help people learn to recognize and tolerate uncertainty? All you have to do is really look at the world around you. The world, especially right now, is a very uncertain place. There are all kinds of political hotspots, things that are going on around the world, things that are going on domestically that scare us all because of the uncertainty and the potential for destruction. How could you not be anxious under these conditions? But at the same time, there are the recognitions and tolerances for ambiguity that are just a part of everyday living. The decisions that you have to make of, should I go to this party, / shouldn't I go to this party? Should I take this class, / shouldn't I take this class? Should I meet with this friend for lunch, or shouldn't I meet with this friend for lunch? Should we put our kid in this school, or should we put our kid in that school? There aren't any guidelines. People have to be able to make decisions in the face of inadequate knowledge, and that leaves people feeling somewhat vulnerable. But part of the problem is, if you think you should be certain, if you absolutely want to know, this is why people make up stories about things that are unknowable. When someone asks a really tough question, this mother loses her 2-year-old to leukemia, and the mother is sitting in your office and she's crying her eyes out, and she says, why did this happen? Why my baby? Is there anything that you could say factually that's going to make a difference? If you say a certain percentage of children die from leukemia each year, that's not going to help her. So there are some questions, and this is my point, that are unanswerable. We can't answer some questions, and yet people want certainty. So people will become certain about things they can't be certain about. I'm always amused when people say, this is what happens after you die, like they know. Things are unknowable. To be able to recognize that and tolerate it is one of the most important skills we could teach people. How to say, I don't know, rather than making something up that is self-injurious, self-damaging, which is what highly anxious patients do and what depressed patients do. By the way. So they need that ability to recognize and tolerate ambiguity. So, from a technique standpoint, what I'll often have people do as an assignment is pick 3 or 5 ambiguous events that happen each day. And there's plenty to choose from. You say hello to someone in the hallway at work and they didn't say hello back. That's an ambiguous situation. Now, I want you to write out at least 3 different plausible explanations for why they didn't say hello back. Then, when they write the 3 out and I ask them, okay, so which one is it? I'm pushing the person to say, I don't know. Things that you don't know. Things that you're not going to know. You apply for a job. You don't get it. Why didn't you get the job? Ambiguity. Cannot say that word. You don't know why you didn't get the job. But if you're sensitive about your education level, you'll say it's about your education. If you're sensitive about your gender, you'll say it's about your gender. If you're sensitive about your sexual orientation, you'll say it's because of your sexual orientation. And the reality is you don't know why and the reality is you don't know why you didn't get the job, and you're not going to know, because even if you call the interviewer up and say, "So why didn't I get the job?" and now you face the next ambiguity, are they going to tell you the truth? So life is about ambiguity upon ambiguity, and for people prone to anxiety, that is the source of their distress. They want certainty in places they can't get it. So teaching people through exercises like that, how to view things from multiple perspectives, how to recognize, are any of these questions answerable? Are there data? You know, if someone says, "What's the best car to buy for gas mileage?" That we can research. But what happens after you die? Not so sure. Dr. B. So when it comes to treating anxiety, it can be important to try and assess how skilled a client is in coping with uncertainty. In addition to that, we might look at the question of, is the client able to reasonably estimate danger and get an accurate sense of their own resources? So what might this look like in clinical practice? Well, next, Michael will share the story of helping a client evaluate her own skills to find out what was throwing off the formula and causing her so much anxiety. Dr. Yapko. So it was a woman by the name of Lena, Lena, who had just broken up with a recent boyfriend of many years. She said that she knew early on that this wasn't a good relationship, but she just couldn't seem to get out of it. And she said, "This has kind of been my pattern, and then when the relationship breaks up, I'm really depressed." But then she goes on to say, "And right now I feel so fragile. I don't feel like I could trust myself to take care of myself," her words. And she said, "I feel like I'm always in the danger zone. I'm single. I don't want to see any man. I don't want to be around any men. They're all dangerous. They all have the potential to hurt me. I don't want to be around them." So consequently, she's very anxious, hypervigilant, because there are men in the world and it's pretty hard to go anywhere without running into a man. And she views each man as a potential threat. So for as long as she feels that anxious around members of her own species, she's going to have some pretty tough times ahead of her. If you listen to the patterning, she has an external locus of control. That the men are in control. She just is their potential victim. Can't operate that way. Clearly, therapy is going to have to help her develop an internal locus of control, that she's in charge. Nobody can hurt her unless she lets them. Nobody can get close to her unless she lets them. Nobody's going to become her next boyfriend until she chooses him. That sets up a discrimination question that I asked her. How do you assess the men that you go out with? And she literally stared off into space for about 10 seconds while she's going, before she finally asked, "Assess?" I said, "Yes." She says, "What do you mean?" I said, "Well, how do you determine whether this is a good guy to go out with?" She asked again, "What are you getting at? How do you evaluate whether this guy's characteristics are going to match well with your needs and who you are?" And then the long pause before she said, "I don't know." Well, that's what spoke volumes to me. Going into her attachment history, unnecessary. She's so focused on whether she's okay. Am I okay? Am I okay? Am I okay? It never occurred to her to ask, is he? To really evaluate him. She doesn't have those assessment skills, and talking about her attachment history isn't going to help her get them. So I did again a single hypnosis session with her. Hypnosis is a great focused experience to absorb new ideas and new possibilities. And that's really all it is. It's a vehicle for giving people perspectives and ideas at a much deeper level in a more focused way. So I did a hypnosis session with her in which I talked about I'll be going from general to specific as hypnosis sessions tend to go. Each person's different, of course, but the question is, how are they different? What is it that drives this new person that you've just met? What do you focus on to determine who this person is? How they make decisions, what matters to them, what they're capable of, what they're not capable of, and gradually introducing a shift from an internal to an external orientation, focusing her on the guy, helping her understand between the lines that when he says this, here's what it indicates about his value system. Here's what it indicates about where he places responsibility for the things that happened in his life. A very key component of assessing someone. People who blame everybody else for the bad decisions they make and so forth. And so I'm introducing these things to her, just continually reinforcing. You have the ability to listen. You have the ability to understand. You have the ability to see through what people are telling you. Nobody is going to say outright, hi, I'm remarkably superficial and very egocentric. You're going to have to figure that out for yourself, and here's a means for doing that. So, to be better at assessing people and feeling empowered to make better choices about who you bring into your life, those were the themes of that session. And of course, that's typical for treating anyone with anxiety, really. How do I make sure you have the resources to handle what you need to handle? Reminding you what I said earlier about people overestimating risks and underestimating their own resources. Connecting her to all those internal resources and how to handle dating and what to self-disclose and when to self-disclose and all those kinds of specific skills. And the session went beautifully. She observed it all. The session was recorded. She had the opportunity to listen to it many times and continue to glean more and more of the skill sets from it. And 2 years later, I get a message from her, an email, where she's telling me she's in the best relationship she's ever had, and thank you for helping point her in the right direction. So this is an important thing. Anxiety is not to be avoided, can't be avoided. There are too many ambiguities in life, but we can certainly make sure we have the resources that we need to meet life on life's terms. Dr. B. After learning a few key assessment skills, Michael's client felt more equipped to cope with uncertain situations that used to cause her anxiety. For more on this, here's Dr. Ron Siegel. Dr. Siegel. Well, I actually had two thoughts on this. One was there's a practical, realistic aspect to this, but in some ways, the bigger insight or important contribution that Michael was making was shifting the locus of control from it being outer to inner. And certainly the assessment skills, having good executive functioning, figuring out who's trustworthy, who isn't, who's good to go into a business partnership with or a romantic partnership with, and who might not be so good at that. Those are clearly important skills, but I was thinking of it in an even broader way. There's this great line that comes from Tibetan Buddhist traditions, which says, looking for happiness in external conditions is like seeking sunlight in the north-facing cave. And I come back to that line quite often, both in working with my own mind and in therapy, and realizing to what degree it is really my reaction to events rather than events themselves, or my client's reaction to events rather than events themselves, that's determining their experience. And is there a way to shift it to see, can we work with this? And this is the idea that, interestingly, in Buddhist psychology of dukkha, D-U-K-K-H-A, this thing that gets translated as life is suffering, which is probably a very poor translation. A much better one is the mind is always complaining, or we're always trying to tweak experiences to make ourselves happier. I think about this a lot, and I find the therapies that have been most transformative that I've had a role in are the ones in which people make this fundamental shift from thinking it's about fixing the external circumstances to it's about working with how I relate to changing good and bad fortune. And this isn't an argument for not getting out of a bad relationship, or not changing jobs, or not changing our political system. There's a role for the external, but I think it's very important to see what happens internally. And it helps us in dealing with all sorts of things, because when we seek happiness through fixing it, I think it tends us toward addictions. We get hooked on winning. We get hooked on self-esteem We get hooked on self-esteem boosts, on substances, on good fortune. Ultimately, I think it's a shift from getting hooked on good fortune as a way to feel good to shifting how we relate to experience that is most freeing for people. So I saw Michael's talking about this in terms of executive functioning as a part of something broader. But I do think it's useful to recognize that even if we make all the right choices and even if all our ducks are in a row, maybe I'm thinking of this because I was recently collating a meditation retreat for psychotherapists, and the subtitle for a meditational retreat for psychotherapists as a silent retreat in a beautiful natural environment is always trouble in paradise. You know, here we are in this external circumstance, which is so nicely constructed, and yet the mind creates all sorts of trouble. So I may be more sensitized to that side of the equation at the moment. I think both sides are important. Dr. B. Ron's perspective reminds us once again that there are so many factors that can contribute to anxiety. In the next session, we'll look at how to work with anxiety when it gets compounded by trauma and other challenging factors. I'll see you then.